Hello, my name is Dr. Thomarish. I am the Director for AMARA Trauma Emergency Services at AMARA Hospital in Tirupati.
డాక్టర్ గారు, భారతదేశంలో కుక్క కాటు ఎంత పెద్ద ప్రజారోగ్య సమస్య?
Actually, dog bite is a very big public health emergency in India, and it's a matter of concern. There are millions of dog bites which happens in our country every year, but unfortunately 1/3 of the death from dog bite, which is basically from a very fatal disease called rabies, are from India, and we should take it seriously.
డాక్టర్ గారు, వైద్యులు కుక్క కాటును ఎందుకంత తీవ్రంగా తీసుకుంటారు?
As I just mentioned, the dog bite may lead to a fatal disease called rabies, and if rabies happens, the chances of death is very, very high. But the good thing is, rabies is absolutely preventable, and if we take steps in time, we can prevent rabies.
డాక్టర్ గారు, ప్రతి కుక్క కాటు అది చిన్నదే అయినా ప్రమాదకరమా?
Yes, every dog bite should be treated as a dangerous bite, even if it is a scratch, because a minor amount of saliva of the dog, if it goes inside the skin, which is broken during dog bite, can lead to passage of the virus which causes rabies and can lead to rabies.
డాక్టర్ గారు, కుక్క కాటు తర్వాత ఒక వ్యక్తి మొదట చేయవలసిన పనేంటి?
First of all, you should get away from the dog and prevent further bite. That's one. The second thing, which is the most important step as a part of first aid, is to wash the site of the dog bite with water and soap, and that you should continue for at least 15 minutes. And this itself reduces the viral load by 90% and can prevent to have fatal rabies.
డాక్టర్ గారు, చాలా మంది ఇప్పటికీ పసుపు, కారం, నిమ్మకాయ, నూనె లేదా అగ్గిపుల్లలతో కాలిన గాయాలకు ఉపయోగిస్తారు. ఇది ఎందుకు హానికరం?
This is not at all useful. First of all, this increases the chance of infection. Second, it delays the definitive treatment which is available in the hospital or clinic. And third, it gives you a false confidence that it will be okay. But even after all these things, if patient develops rabies, it will be very fatal.
డాక్టర్ గారు, కొన్ని రోజులు వేచి ఉండి కుక్కను గమనించడం సురక్షితమేనా?
Not at all. The rabies has got variable incubation period, and observing dog leads to delay in treatment. So do not wait and observe the dog. Go for treatment to the doctor or to the clinic or hospital.
డాక్టర్ గారు, కుక్క కాటుకు గురైన రోగికి అమరా హాస్పిటల్లో ఎలాంటి చికిత్స లభిస్తుంది?
There are various treatment, and these are all available in most of the hospitals. First of all, there are anti-rabies vaccines. There are immunoglobulins which can give ready-made immunity, and people or doctors do give tetanus injections and, if necessary, some kind of antibiotics.
డాక్టర్ గారు, ప్రజలు రాబీస్ ఇంజెక్షన్లకు భయపడుతున్నారు. అవి ఇంకా బొడ్డు చుట్టూ ఇస్తున్నారా లేదా ఇప్పుడు ఏమైనా మారాయా?
That's a very wrong concept. The rabies injections are very safe. They are given just like other injections, and they are given in the arm, or at the most some quantity of the rabies immunoglobulin are given at the site, and these are not at all painful, and one should receive it when prescribed by the doctors.
డాక్టర్ గారు, తీవ్రమైన రాబీస్ బారిన పడే ప్రమాదం ఎవరికి ఎక్కువగా ఉంటుంది?
Generally, children and the old age people, they are at higher risk, because sometimes you get bites on face or head, and these bites are fatal. And the people who are immunocompromised, like patients who have cancer, other immunocompromised states, or diabetes, they are more prone to infection.
డాక్టర్ గారు, కుక్క కాటు తర్వాత ప్రజలు చనిపోవడానికి అత్యంత సాధారణ కారణాలు ఏంటి?
The most common reason is delay in treatment and not receiving the rabies vaccine or rabies immunoglobulin, and going for the traditional treatment and not coming on time. These are the reasons, because it's a 100% preventable disease.
డాక్టర్ గారు, కుక్క కాటు సంబంధిత మరణాలను సంఘాలు ఎలా నిరోధించగలవు?
First of all, whenever a dog bite happens, one should go to the hospital or to the doctor or clinic for treatment. Second is increasing awareness to the kids as well as young people on what to do in case of dog bites. And thirdly, it is important to control stray dogs in municipal settings if the number of dogs are increasing, and that's a civic responsibility one can do.
డాక్టర్ గారు, చివరిగా కుక్క కాటు సందేశం ఏంటి?
I think the final message is dog bite is 100% preventable. Don't waste time, go to the hospital and ask for treatment. And immediately after dog bite, wash the site with soap water for at least 15 minutes. Again, snake bite is a very important silent killer, I will say, in India, mostly in rural settings, but some of the urban settings snake bite is very common. Snake bite is again a very preventable death, provided you ask for medical help and reach to hospitals for treatment. There are some snakes which are non-venomous, and there is something called dry bite, where the snakes bite but the venom is not passed. But the common people have no way to judge this, so treat every bite as a venomous snake bite and reach to the hospital on time. I think the first thing one should do is reassurance and stay calm, because a lot of people think that immediately after bite the people may die. Secondly, I feel that one should reach the hospitals definitely on time, and if there are warning signs, you can talk to the doctor or to the receiving hospitals, and they can guide you on what needs to be done on time. And in case the patient is sick and all the complications are appearing, it is better to transport the patient through ambulance. It is very important. I think these ideas, very much rooted in the society. The first thing one should not do is cut or suck the wound. The second thing is, bandage it or tie it very tightly with a rope, which we'll call tourniquet. This is not at all advisable. Third is wasting time and going to traditional healers and going for alternative treatment. This does not help. And fourth is, I think, avoiding to go to the hospital and wait until the complication arrives. So one should avoid all these things and reach out to the hospital as soon as possible. Tourniquets are not at all advisable during snake bite. One, it leads to complications because you are tying a body part very tightly. Second thing is, if you release the tourniquet, there is a chance that the venoms will release quickly into the bloodstream post release of the tourniquet. So all these are very dangerous and one should not do it. Sometimes the snake venom acts very fast, within minutes and hours, and one should always look for the complications of snake bite. This can be bleeding, manifestations like vomiting, or manifestations like breathing difficulties, being unconscious. All these are warning signs and complications of snake bite, and one should observe this very carefully, and as I said, reach out to the hospital as soon as possible. I think I just mentioned all these complications like vomiting, breathing difficulty, unconscious state. These are all complications and warning signs one should note. Snake bites are treated very effectively, efficiently and fast in the hospitals. Once patient reach to the hospitals, the doctors do their own emergency assessment and look for complications. If the complications are there, they will start supporting it. That may mean the patients will be put on ventilator if it is required. And the mainstay of snake bite treatment remains anti-snake venom, which is available in most of the hospitals. And these anti-snake venoms are common for all the snakes which is available in India. So we don't need to identify the snake. We just need to give the patient anti-snake venom and continue to support the body functions until the patient is out of danger. Yes, anti-snake venom is very much safe and it is life-saving. Sometimes after anti-snake venom injection, patients may develop some allergic reactions or complications, but the doctors and the hospital is fully equipped to control that, and it is better to have anti-snake venom because it saves lives, and it is the only medication which saves from snake bite. Not at all, as I just said, the anti-snake venom is common and it can save against all the variety of snakes it is available, and if you try to kill the snake or try to catch it, it may lead to multiple bites. So do not try to do that. Straight away send the patient to the hospital, preferably in an ambulance. Generally what happens in rural settings or in semi-urban settings, people walk barefoot, so wear protective shoes while walking. Do not try to venture in the night carry a torch at least to see what is coming ahead. And there are a lot of snake bites which happens to the people who sleep on the floor. So avoid sleeping on the floor, because there are some snakes which venture in the night time and can bite, especially the kids. So do not avoid sleeping on the floors. These are important steps to prevent snake bite. I think snake bite is again, the complications of snake bite is absolutely preventable. Reach as soon as possible to the hospital, and ASV remains the mainstay of treatment in case of snake bite. Avoid all traditional treatment and traditional healers. They don't help in snake bite, they waste time, and people may lose their life or limb in case of snake bite. I think snake bite is kind of a national problem for many years in India, and it is the effort which is required not only from doctors or the hospitals, but also from community and every citizen of India to prevent and take the possible steps to avoid snake bite, and most important, reach out to the hospital as soon as possible in case of snake bite. Thank you. So AMARA Hospital, as you know, we have got a state-of-the-art emergency department, and we have got our own ambulance systems which you can call in case of emergency. And on arrival, AMARA Hospital is equipped with all necessary life-saving and limb-saving treatment which is available right at the door in emergency department. We are manned 24/7 by a trained consultant. We are available as not only in emergency department but all across other specialties, who can be available in a very short time to address these emergencies. In addition, we have got state-of-the-art laboratory services, blood bank services, and state-of-the-art imaging services, including a 3 Tesla MRI system which can detect very subtle emergencies, especially in case of stroke, which is kind of life and limb saving at some point of time. Because our hospital is close to highways, we often deal with a lot of accident cases, and in these cases, presence of trauma team makes a difference between life and limb. So we have got 24/7 round the clock trauma team available, which consists of emergency physicians, intensivists, anesthetists, surgeons, radiologists. All together we make a decision to save trauma victims, as well as we also have 24/7 presence of cath lab and cardiologist, where we can treat acute heart attack. So in a nutshell, we are equipped to treat all kinds of emergency across all age groups with all cutting edge instruments, and we follow all internationally approved protocols. AMARA Hospital, we believe, is one of the leader in emergency services in this region.